Today's episode about eyeballs is brought to you by the Nuance Dragon Ambient Experience, or DAX for short. This is AI-powered technology that helps physicians be more efficient and reduce clinical documentation burden that causes people to feel a bit overwhelmed and burnt out. To learn more about how DAX Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discover-DAX. That's nuance.com/discover-DAX.
Knock, knock, hi.
Knock, knock. Hi. Hello, everybody. Welcome to Knock, Knock, I, with me, your host, Dr. Glaucomflecken, your one-stop shop for all things eyeballs. We just talk about eyeballs. Occasionally, we touch on other subjects, which we will today. I've got something I've learned recently that I'd like to talk with you guys about. Real quick, though, I keep waiting for the false eyelashes to reach their maximum length. Somehow they keep getting longer and thicker and more glued on. Listen, I'm fine for body modification, for cosmetic procedures. Like, that's fine. Do what you want to do to live your life and make yourself happy. From an ophthalmologist standpoint, though, I hate these things. They're the worst. Because I look at eyes all day through a microscope, and when I look at these eyelashes, there's, first of all, when you look at, now we're talking like 10x, 12x, something like that. There's glue everywhere. Like these, wherever people are getting these done, I assume they're at beauty shops, or I think there are people that this is all they do is they put fake eyelashes on all day. And they're gluing them on. Most of the time they're gluing them on, and the glue just, it's kind of gross to look at, if I'm being honest. The glue gets everywhere. It's on the skin, on the eyelid skin. It's not just on your natural eyelashes. That glue gets everywhere. And what it does is it traps all the normal, natural, sebaceous, oily secretions from your eye, from the oil glands in your eyelid, all that stuff. Normally, when you blink, your natural eyelashes, it brushes that stuff away. It comes down into your tear film, and it gets whisked away through your tear drainage system. We're talking like all the dead skin cells and just the normal skin stuff. Normally, that stuff, it gets cleared out. And then also when you wash your face, like that stuff, you wash it off, right? You give yourself a face wash and you get rid of some of that stuff as well that way. The point is, all that stuff, normally, the oil, the skin cells, it goes away. It doesn't just sit there. But when you have these super thick, long, false lashes that are glued in place, and the glue is actually gluing some parts of your own natural eyelashes together, all that stuff, it just traps all that oil, all those skin cells. They have nowhere to go. Even if you try to just wash your face, it's stuck in there. It's stuck in the glue. It's stuck in between the false lashes. And that, over time, sometimes quickly, sometimes after a month or two, can start to cause inflammation of the eyelids, and you start getting itchy, irritated eyelids, and redness and discomfort, and it feels like sandpaper in your eyes. And I'm biased here because I'm an eye doctor, and I do see when like it goes wrong for people because they come in and see me. But man, is it worth it? Is it? And I know because Kristen she buys these fake eyelashes, but they're like one-time use things. It's like adhesive. It's not glue. It's not permanent. And you just, like, for a special occasion, you just it goes right over the top of the lashes, and then you take them off at the end of the night. And it works great. It's awesome. And she's got these fake lashes. They're not the big giant ones, but they're just, they look really nice and they look natural. I don't know. I think it's maybe just a generational thing, cultural thing. I'm not sure. I'm not going to speculate on why these are so popular. I don't personally understand it, but that's okay. I don't understand a lot of things. But as an ophthalmologist, like I wish people would not like permanently glue lashes onto their eyelid. I mean, it's not permanent. You can remove them, but it's a pain. And so I've seen, I think, 2 patients like recently and over the past week, and I've had to have this conversation with them, and it's just tough. And I feel bad for people that don't realize that going into it, because I'm not sure what kind of informed consent you're getting when you get these fake lashes put on. Anyway, that's my rant for the day. My don't do that eyeball tip of the week. Let's stop with the long, giant fake eyelashes. And I swear they're getting denser. It's just they're packing in as many of these false lashes as possible, and it just makes the eye irritation problem worse. So anyway, it's my 2 cents. I know I feel like I'm probably sounding like an old person here. It's like old man, screaming at a cloud kind of thing. But anyway, all right. So before we get to our, we're actually, today is going to be a kind of a lighter topic. I've had a couple really kind of intense episodes. Thyroid eye disease, not so intense, but serious. And then before that, it was eye worms, which just turned out, it was very serious for some people. And in terms of making them feel like they have eye worms listening to me. So we're gonna do something a little bit lighter, a little bit more fun. We're gonna go over through some eyeball myths, some of the more common myths that we've all heard either growing up or even in our adult life on social media these days. Like you'll hear some of these things. We're just gonna go through as many of them as I have time for. Okay, I came up with a whole list of them, like 20 eyeball myths that I hear on social media, even people ask me about in my day job. So we'll get to that. The first thing I told you, I learned something today. This is an insurance thing, health insurance thing. And so I just got to talk about it because I love and hate hearing about these things, but it illustrates an important point. So I'll just tell you the issue first. So this is in the world of anesthesiology. And starting in July 15th, Aetna, which is one of the largest multi-billion-dollar health insurance corporations that I'm always railing against. I think in one of my videos, I specifically called Aetna evil using their logo. They didn't come after me, thank goodness, but they could have. I would have accepted that. But anyway, Aetna's a big one. They're a big player. And what they decided to do is, so when you have surgery, when you get general anesthesia for surgery, you are given what's called an ASA score. This is basically a score that assesses your risk of receiving general anesthesia. So it's a physical status modifier. So let's say someone who's totally healthy, say they're like 20 years old, never had a single health problem. They're like ASA 1. So super healthy, right? Almost zero risk there's never a 0% risk of anesthesia, of receiving general anesthesia, but they're close to it, right? And then it gets higher the more health problems you have. So say you have like severe COPD, you're on inhalers, or you're on oxygen, you've had 3 heart attacks, and you have a leaky aortic valve. Like that, you're going to be like an ASA 4 or an ASA 5. The risk of giving you general anesthesia is fairly high. What's the risk? Risk of what, you ask? Like risk of having a stroke, or having an aspiration event, or having or just death. Like that's always a risk when you undergo a surgical procedure, when you receive general anesthesia. Things can happen. If your heart's not healthy enough, you could go into cardiac arrest or have a heart attack, or so any number of things could happen. And so that's what your ASA score is based on. And as you can imagine, if your score is higher, like a 4 or a 5, you might require a bit more attention during surgery. You might require more medications or different medications, or maybe the surgery will take a little bit longer, or it's more work. And so what anesthesiologists have done for decades is they bill for their services in part based on your risk of surgery. So if you are a high risk at ASA 5 and you require all this extra work, well, it makes sense that that's going to be just a higher level of service. And this is the way it works in this country. You'll be billed for that service. And if you're an ASA 1, it's a breeze, no big deal. They just, the anesthesiologist can put you to sleep, put the tube in, and sit there and check their investment portfolio. Oh, well, you're not going to have to pay as much for their services. Well, what Aetna has decided to do is just totally get rid of those modifiers. So if you're an ASA 5 and you're going to get, the anesthesiologist is going to get paid the exact same for an ASA 1 versus an ASA 5. And for more amount of work, they just basically won't get paid for that work. This is just a version of reimbursement cuts, which is something that a lot of physicians, almost pretty much every specialty, is always kind of advocating against, is the constant cuts to the physician reimbursement that happens every year with Medicare rates and commercial insurance rates as well. And the immediate, I feel like the reaction from a lot of like the general public, and maybe to some of you listening to this, is like, boo-hoo. You're a physician. Why are you complaining? You're so well paid. And there's some truth to that, but it's like death from 1,000 cuts, right? You're constantly being told that what you do, your expertise, is not worth this amount. We're going to cut it. We're going to cut it a little bit more. Oh, we don't care that this patient who's extremely ill and needs surgery and requires you to practice at the top of your medical license. We don't care. We're not going to pay you extra for that. And the reason this is dangerous, that this is just a bad thing, is because of what it means for just generally patient care. Because what will happen, I guarantee this will happen, is that hospitals, and so let's say, United Healthcare owned hospitals or private equity owned hospitals, they will look at this rule from Aetna, this precedent that Aetna is setting, and they'll say, okay, Aetna's not going to pay us what we think we deserve for taking care of the really sick patients. So what are those hospitals going to do? They're going to not take care of those patients. They're going to say, you got to go to the county hospital. You got to go to the university, where they have other sources of state funding, all right? And it's going to overload those systems, or patients going to have to travel to 3 hours or more to get the care they need at a different place that's not where their doctors are. And that's really what irritates me about decisions like this. And it's always these little tiny cuts. It really is death by 1,000 cuts. It may be a small thing, flies under the radar. Oh, we're getting rid of the status modifiers. ASA 345, we're not going to pay you extra for that. The downstream effects of that can be enormous in terms of the ability for patients to get the care they need, where they need it, by the doctors they need to get it from. And so it goes beyond just, oh, poor doctors, they're not going to be paid as much. It's really just it's also just about the ability of patients to get that care, because there's a lot of downstream effects from that decision. So anyway, that's just something that Aetna's doing, and I learned about it recently, and I just wanted to talk about it, talk through it. I might do a video on it. I don't know. We'll see. It is a bit in the weeds, but that's what I like to shed light on some of these kind of under the radar things, because these insurance companies, you guys, they're always doing things. All right, let's take a break and we'll come back with our eyeball topic. Okay, we are back. I said we were just going to have fun today, and then I brought everyone down with terrible things that health insurance companies are doing. By the way, I think probably, as usually happens with these things, other insurance companies are going to see how innovative Aetna is. Oh, you're not going to pay for the ASA 4 and 5. Oh, I want to do that too. And it's just going to, anyway. So I'll move on from it though. I'm over. I'm done with it. I'm done until I'll think about it again later, maybe do some more stuff. But anyway, all right. Eyeball myths. This is what we're going to talk about today. Eyeball myths. I'm going to debunk some eyeball myths and maybe make fun of them as well. All right. So this is not in any particular order, except the last one is the most nefarious one that I'm going to address. But we'll just go through them. So the first myth that I'm sure many people have heard about is that babies are born with their eyes fully grown. I heard this like as a med student. I feel like I believed this as a med student until I actually maybe even got into ophthalmology residency and I was looking at an ophthalmology textbook because I'm old and I still use textbooks. I still have textbooks. Until I read, oh, wait, no. Generally, babies are born with their eyes approximately 2/3 of their full adult size. Yeah, that's right. So they're about 17 millimeters long. That's how long it is. And I'll tell you, if a baby was born with fully formed adult eyes, that would be a bit horrifying to look at. It'd be strange. Maybe actually cute. It might actually be cute. Large eyes in a baby. But it would alert us to the possibility of congenital glaucoma. Because there's this disease called, it's called congenital glaucoma, but one of the findings in that disease is called buphthalmos, 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 or maybe there might be another H thrown in there. We like our H's in ophthalmology. Anyway, buphthalmos is when what happens because when you're a baby, all your tissue is pliable. And that includes the sclera of your eye. And so if that newborn's eye has high pressure in it, over time, it's going to actually enlarge the eye like blowing up a balloon. And the eye will be much bigger than a normal baby's eye. And usually it's unilateral, right? It can be bilateral, but I don't know. Actually, I need to look at it. It might be mostly bilateral. Anyway, it can be unilateral or bilateral. That's the point. But you can see a clear difference. One eye is just much larger than the other, and that's a really dangerous, blinding condition to have. So no, babies are not born with their eyes fully grown. They are born with their eyes approximately 2/3 of their full adult size, but they continue to grow after birth, and usually in 2 phases. So in the first few years of life, they'll grow. So until you're like 3, maybe 4 years old, and then they kind of stop growing for a bit. And then puberty hits, and then they keep growing and that's when you see a lot of people start to come in with new onset. A lot of kids come in with new onset myopia is because puberty, they're hitting that, hormones, everything, causing their eyes to get bigger and sometimes too big, and they end up nearsighted. So that's myth number 1. All right, myth number 2. If you cross your eyes, they will stay that way. That is not true. The only way they'll stay that way is if someone slaps you on the back when your eyes are crossed. No, that is a joke. Don't quote me on that because that's not true either. All right, but that's the way I heard it growing up. Don't let someone hit you on the back when your eyes are crossed because they'll stay that way. That's obviously not the case. I don't know where that comes from either. It's your eye muscles. I mean, they allow your eyes to move in all different directions, right? And there's no way that they'll just get stuck. Actually, that's not true. There is one condition in someone who has had significant like head and neck radiation. Sometimes you can get this disorder where the eye will get stuck in one place, but then it'll eventually move. But temporarily it gets stuck. Don't worry about that. I don't even remember what that's called. Some of my fellow ophthalmologists can help you with that. But no, they won't get stuck that way. All right, myth number 3. Eating carrots will improve your vision. Don't get me wrong. Like, carrots are great. Vitamin A, fantastic. It's essential for your body in order to maintain healthy eyesight. You need carrots. You need vitamin A. Actually, you don't need carrots. You just need vitamin A. But the body, including the eyes, only requires a small amount of vitamin A for especially for vision, and that you can get that through lots of different ways. So it doesn't have to be carrots. All right. Although I have been known to bring a bag of baby carrots on a plane with me. Sometimes I like to eat them on the plane, and then when someone looks at me funny, I'll be like, I'm an ophthalmologist. And then for the rest of that person's life, they'll insist to others that they need carrots to be able to see. No, I've never done that, but I've thought about it a time or two. So, vitamin A, carrots, you can get it from dark leafy green vegetables. Dairy has vitamin A, fish has vitamin A, lots of different sources to it. Don't have to just gobble down carrots. You can if you want. I mean, it's hard to, unless you're eating polar bear liver, you can't overdose on vitamin A very easily. I guess if you take supplements, you could. Anyway, don't do that. Just eat a normal amount of carrots, everyone. Okay. Next one. Next myth. I think that's 3. Let's do another one. Myth number 4. Sitting too close to the TV will damage your vision. I heard this a lot as a kid. All right. My parents just getting tired of me watching TV all the time. That is not true. It can cause eye strain, and you see this a lot with kids. Kids will sit very close. My kids do it whenever they're on screens, like they got the iPad, like right up next, almost to their nose. And the reason kids do that is because they have this incredible ability to focus their eyes up close. We've talked about that. It's called accommodative ability. Their ability to accommodate, bring their focal point from distance all the way up. They can do it all the way up to their nose. All right, those of you who are in your late 30s, 40s, 50s, 60s, see how far you can get. Bring that finger up close, unless you're really nearsighted, then you can do it. But if you're not nearsighted, try to bring it. I start losing it I'm now about probably 6 or 7 inches from my nose. That's as far as I can. I've lost it. I'm losing it. I'm 38 years old. I'm going to continue to lose it. But kids, all day, they can sit there with the screen right there. But they still, even young people can get eye strain. I see this a lot with people in their 20s, 30s. Long hours on a computer, you can start to get strain. And the way strain, it's called asthenopia. You start to get a brow ache above the eyes. That's your sign that you're having a little bit of too much screen time, a little bit of strain. Take a break. All right. Rest your eyes. Rest those muscles, those ciliary muscles that are constricting and allowing you to accommodate and see things up close. But it's not going to damage your eyes. Just a little bit of eye strain, but that's not permanent. That's reversible. It's just a part of being a kid, is being able to use that. I did use it. Just enjoy. I wish kids knew what would happen when they turned 40, because they will miss that accommodation. All right. Next one. Next myth, and I've talked about this one before, but it's worth talking about again because I still keep getting question after question about it. Blue light blocking glasses. So this is like a partial myth, because there is decent data that shows that blue light blocking technology, glasses, can help regulate your circadian rhythm. So basically, like staring at your screen in the dead of night in bed right before you try to go to sleep, it might mess up your sleep a little bit. And so, you could just force yourself to not look at a screen. I'm just as guilty as all of you, okay? But if you just don't look at the screen, you'll take care of that. You don't have to buy expensive blue light blocking glasses. But you can if you want, and studies have shown that might help. But the problem with all these companies that are selling blue light blocking technology in their glasses is that they sell it on other things. They sell it as a way to maintain the health of your retina, or that they help with decreased eye strain. There's no data to suggest that any of that is true. All right, it's just the circadian rhythm stuff. Looking at your phone late at night, yeah. That's the only time maybe blue light is. If it's worth it to spend $400 on blue light blocking glasses, go for it. And this isn't not like a dangerous myth, I would say. It's just it's just like false advertising basically, and you're out some money. But blue light blocking, this is what I tell my patients. Like I tell them about the data, and then I tell them, it's not going to hurt your eyes. Use it if you want it. And if it helps you, if there's a little placebo effect there, go for it. I don't care. Like, my job is to tell you what I think is worthwhile and what's not, what's right, what's real based on evidence. And so if people still want to go for it, do it. Blue light blocking glasses. Not dangerous, but mostly unnecessary for the reasons that people sell blue light blocking glasses. Whew, I've talked about blue light blocking glasses a lot. In clinic too, people ask about it a lot. All right, next one. I forgot what number we're on. I like myth number 6. I got there's so many eyeball myths. This one I have addressed recently. There was somebody on X that had this long thread. There's like a number of these of people that are selling you. This has come up more frequently since Elon took over. A lot of people like selling things on formerly Twitter X in the form of these threads that are like advice threads, and then at the end of the thread they're like, here, buy my course or whatever. So there was one recently about eye exercises, and that's the next myth, that eye exercises can improve your vision. So this is not true, right? And you hear this a lot. I've seen this a lot on TikTok as well. Eye exercises will not improve or preserve your vision or reduce your need for glasses. You cannot exercise away your need for glasses. You guys, it's just physics, optics. It's the properties of light, which are the reason why you need glasses. Your eye refracts light differently than somebody else, and it makes it to where it's not quite refracted in the right place in your eye. And you need to put a lens in front of your eye to redirect the light onto your fovea, allowing you to see perfectly again. That's all it is, right? It's not, and you can't move your eye a certain way or focus your eye in different places, and it's not going to change that. All you're going to do is give yourself eye strain. That's not going to decrease your dependence on glasses. So you cannot exercise away your need for glasses. There's one situation where eye exercises can be helpful, and that's in people that have what's called convergence insufficiency. So we see this in kids sometimes, where they have they have an inability to bring their eyes together to look at things up close. So they maybe start to getting a little bit of double vision or fatigue. And in those patients, we'll do something called like pencil push-ups. There's different ways to do it. Parkinson's disease is another thing where people will have convergence insufficiency. Obviously, that's in older patients, and so exercises don't work as well, and you end up having to use Prism. So usually it's just kids that we will do the pencil push-ups. But that's a very specific case, and that's not everybody. And so you'll hear a lot about people, you should do eye exercises or vision therapy. You don't need that. That's not going to decrease your dependence on glasses. You either need glasses or you don't. Which brings me to my last myth that I want to talk about, which is, as I mentioned earlier, the most nefarious, the scariest myth, the one that makes me more angry than anything else that I hear on the internet, is that wearing glasses will make you dependent on them. If you guys listen, I think maybe about a month or two ago, I talked about amblyopia, lazy eyes. And this is, I think I addressed this during that episode, and I'll do it again right now because this is very important. The reason this is dangerous is it's people on social media talking about how, you don't wear glasses because the more you wear them, the more you have to wear them. Again, we've already discussed it's just light. It's just physics. You can't defy the laws of physics. All right, the properties of light are going to be there regardless of what you think or what you saw on social media. But this is dangerous because parents will see people talk about this, and then they will purposefully avoid glasses for their children, thinking that if their kid wears glasses, they're going to get dependent on them, and their eyesight will get worse, and they'll need stronger and stronger glasses. And this is particularly dangerous in young people, and young kids. I would say like age basically from birth to about 7 or 8. All right. Because if those kids need glasses and they don't get in glasses, then they can get permanent, lifelong vision loss. Their brain will not learn normal vision in one or the other or both eyes. And that's the saddest thing, when it's so easily preventable. Because a lot of kids who have a lazy eye, a lot of times sometimes you need patching. You need to patch one eye or the other. I'm sure many of you listening have had that experience as a kid. Sometimes all you need is to get that kid in a pair of glasses. And it's so frustrating, and it makes me so upset when you see people who refuse to do it because they're afraid that it's going to make their kids' vision worse and more dependent on glasses. So once you're like 7, 8, 9 years old, that's around more like 9 years old, maybe even 10. That's when your visual cortex fully develops, and your vision more or less locks in. Like you're at the vision that you're going to be for the rest of your life, barring other medical problems, obviously. But before that, vision is very malleable. You can gain vision, you can lose vision. If you take a normal, we'll say 4-year-old, and let's say you put a patch, like a normal 4-year-old, normal vision in both eyes. Let's say you patch that kid's right eye for a month. Well, the brain, because it's still developing those vision pathways, it's just going to turn off that right eye. It's like, this eye doesn't see anything. Why am I wasting my time developing this? And it's going to regress. And they're going to start to lose vision out of that right eye. It's very interesting vision development. And then what you'd have to do if that were the case is you'd take that patch off. Then you got to start patching the other eye to force the brain to start using the bad eye and regain that vision. So that's why patching works. All right, you're patching the good eye and forcing the brain to develop the vision out of the bad eye. But that's getting into a different topic altogether. The point is, no, wearing glasses will not make you dependent on them. All right, if you need glasses, you need them. That's the bottom line there. And that's all the eye myths I have. Oh, here's another one. Some people think that only boys can be colorblind. Oh, that's another one. That's not totally true. I did an episode on colorblindness. Women can develop or inherit colorblindness, but the men are just at much higher risk. So about 1 in 10 males have some form of color deficiency. There's lots of different types. It's much less frequent for women, just because of the way the genes are inherited. But so it's possible. It's just way, way, way less common. Way less common. If you're a woman and you have color blindness, chime in the comments. I'd love to hear from you. That's all I got. I mean, I have more, but let's stop there. All right. We'll maybe I'll do another episode down the road where we get to some of the other myths. Or if you have some myths, do you have things that were told to you by an adult when you were a kid that stuck with you for your entire life, and you're just wondering if it's true? I would love to hear the myths that you have rattling around your head. Let's address them. All right. Mostly, so let's stick with eyeballs because I struggle with the rest of the body. But actually, if there's myths of the rest of the body, I'd love to hear those too. Maybe I could do a surprise special knock body episode where I don't talk about the eyes at all. I just talk about things that I'm wildly unqualified to discuss. That's a good idea for an episode. Maybe if we get bored with the eyeball stuff, but we got lots of more eyeball stuff to go. Thank you all for listening. That's our episode. I'm your host, Will Flannery, also known as Dr. Glaucomflecken. Thanks to my producers, Aaron Corney, Rob Goldman, and Shanti Brick. Editor and engineer, Jason Portiza. Our music is by Omer Benzvi. As usual, if you have something, if you have an email, or if you have an email, we all have an email. Sometimes all we do is email. If you have thoughts, questions, concerns, if I get something wrong, I've had some people like email me like, hey, you screwed up. You didn't say this right. This is actually not correct. I love to hear that. I make mistakes too. Sometimes I misspeak or I'm just wrong, flat out wrong about something. Please send us an email, knockknockhi@human-content.com. I'd love to hear from you. And give me all those YouTube comments, all right? I want to hear them. We recently moved the podcast episodes on YouTube to a new YouTube channel. The Glaucomfleckens is the new channel, trying to separate the skits and the shorts from the longer form stuff and just do them on 2 separate channels. Trying to make it easier on everybody. And so check that out. Subscribe if you like to watch my stuff on YouTube. And that's it. All right, we'll see you next time. Knock Knock I is a human content production. Take care, everyone.
Knock, knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.